Hello, welcome back again to this channel where we talk about the essentials of medical information. Kindly, if you are new here, subscribe, hit the notification bell so that you get to be notified each and every time I upload a new video. For the returning subscribers, thank you so much for always checking on this channel. Let us continue getting this information because information is power. And my name is Rebecca Morangi, and this is the best place to be. Today we are going to look at Hashimoto's disease. We have been talking on the thyroid gland. Hashimoto's was one of the causes of hypothyroidism. Today we are going to look deeper on this disease. Hashimoto's is a chronic autoimmune disease or disorder which affects your thyroid gland. The thyroid gland is a butterfly-shaped gland located at the base of your neck and below the Adam's apple. The functions of the thyroid gland being metabolism, regulating body temperature, it regulates your heartbeat, and even digestion. That is how the food moves in your digestive system. Now, what is an autoimmune? When we say autoimmune, what do we mean? This is where your immune system attacks the healthy tissues, leading to the death of the thyroid hormone producing cells, hence leading to the decline of the thyroid hormones. Thyroid hormones being the T4 and the T3. Who gets Hashimoto's? Anybody can get Hashimoto's, but mostly the middle-aged people, and especially people assigned women at birth than men. Treatment is through thyroid hormone replacement therapy. What are the symptoms? Symptoms one is a goiter, which is the enlargement of your thyroid gland. Another symptom is constipation. Constipation, this one comes because of the low level of thyroid hormones. Your metabolism is slowed. The breakdown of food into energy is slowed. Now it brings the problem with the way you relieve the bowels move out of your body. So most cases, some people get constipation. So that is another common sign. Another symptom is body aches, muscle weakness, joint pains. People get a lot of pains, and in general, body fatigue, where you can't really do anything. You're weak. Brittle hair, all hair breaks, slow heart rate. There is a problem in menstrual cycle. Some people get heavy bleeding, and which is irregular sometimes. So among the many symptoms, those are some of the symptoms people get. Now, how does this mechanism happen? When we say of an autoimmune mechanism, how does it happen? The body produces the antibodies which prevents us from getting infections from bacteria or viruses or from other foreign bodies. Now, here, the white blood cells builds up, or the lymphocytes builds up at your neck, because their work is to protect you from getting infections. So they build up on your neck, which is on the thyroid to be specific. Now, it causes what we call inflammation or thyroiditis, leading to the death of the healthy tissues of the thyroid gland. Now, what happens at the end of it all? It leads to the decline of thyroid hormones because your thyroid has been affected. Now, there is a death of the health cells which produce the thyroid hormones, so there will be a decline of the thyroid hormones. Hence, what we call hypothyroidism, or what we call underactive thyroid, because your thyroid will not be able to produce enough thyroid hormones to function. Now, what are the causes or the onset of this? Sometimes we have the genetic factors, we have environmental factors, being maybe the infections we have talked about, and even stress. Also, there is sometimes an interaction between the environmental factors and genetic factors. What are the risk factors? One is family history. Actually, 8% of this condition, which is Hashimoto's disease, it's from family history. Or if your family member had this, there is a high chance of other people getting this, but not 100%. It's 8%. We have sex, which is women mostly than men. And then we have the age. We said commonly it affects the middle-aged people. Pregnancy, this is a major condition we have been talking about. It's a risk for somebody to have this condition. When there is excess intake of iodine in your body, radiation exposure can increase the risk of you getting this condition. Other autoimmune conditions or diseases like lupus, diabetes type 1, pernicious anemia, these ones can cause this or can increase the risk of somebody getting this Hashimoto's disease. The diagnosis, one, is through physical examinations, by the doctor checking on your thyroid gland, how it looks. Is there swelling, or they examine are there lumps? So that is one of the diagnosis. The doctor can check on the symptoms. The symptoms you have mentioned them of constipation, depression, others getting what we call excess bleeding, especially ladies. So that is one way of diagnosing this. Medical history, if somebody has got this condition, that is one way of diagnosing it. But the confirmatory tests, where the blood tests are taken, one is by checking on your TSH, your thyroid stimulating hormone. This is produced by the pituitary gland. Remember, we said the pituitary gland signals the thyroid gland when there is low thyroid hormones to release these thyroid hormones, the T4 and the T3. So the TSH produced by the thyroid, the pituitary gland, is checked. When it's too high, meaning thyroid is not producing enough thyroid hormones, hence hypothyroidism. Another test is testing the free T4, the thyroxine hormone. Here, when there is a low thyroxine levels in your system, all your blood system, this one shows you have hypothyroidism. Another test is by doing anti-thyroid antibody test. This one, when there is a certain autoantibodies in your blood test, this one shows that you have hypothyroidism, which is caused by Hashimoto's now. And this is the confirmatory test of this. Now, what are the treatment? If you have not every condition, all hypothyroidism is treated. A mild one is by the doctor checking your thyroid stimulating hormone levels regularly. When the Hashimoto's disease has led to hypothyroidism, now the treatment is through thyroid hormone replacement therapy by being given the T4 thyroxine to replenish or to produce the T4, which will function normally the way the normal T4 functions. So that is one of the treatment, thyroid hormone replacement therapy. And this is done, or the replacement is done for the whole of your life. You have to take this medication. The doctor will check on the level of these hormones regularly and to check on the best dosage of this hormone. And actually, the medication on the molecule of this drug is levothyroxine. Levothyroxine comes in different brands, but this is the most commonly used drug. What are the complications of Hashimoto's disease? Complication number one is goiter, the enlargement of your thyroid gland. Another complication is pregnancy. Some people get what we call prepartum birth. Others get premature birth. Maybe you give birth before the right time. There is what we call heart failure. That is one of the complications. We have mental health issues like depression, myxedema or myxedema, sometimes back we mentioned about it. So those are some of the complications of Hashimoto's disease. Now, up to this level, I believe you have gotten something from this presentation. Remember, we have talked about Hashimoto's disease, which is an autoimmune condition. We have checked again on the functions of the thyroid gland. We have reminded ourselves on this autoimmune mechanism. How does it happen? We have looked at the symptoms of Hashimoto's disease. We have looked at the causes. Again, you have checked on the risk factors, the diagnosis, the treatment, and then finally the complication. Thank you so much for always checking on this channel. Continue getting the information. Give the video a like. Don't be mean, just give the video a like. It helps me sometimes. Let's interact. Your company gives me a lot of encouragement to keep on giving more and more of these presentations. Remember, information is power. Hashimoto's, you cannot prevent this condition actually. Again, living a healthy lifestyle, doing exercise, eating well, managing your stress can help you get along well with this condition. Again, the treatment you've had, it's through thyroid hormone replacement therapy, of which you have to do the whole of your life. Thank you so much, and let's meet in the next video. Bye bye.